Need advice? Download the free Hello Doctor app on any mobile phone and connect with our doctors right away for reliable personal advice. Go to hellodoctor.com and chat to a doctor anytime, anywhere for less than the cost of an apple a day. Search for causes of a stomach pain on the web and you'll be warned that you may have cholecystitis or duodenitis, mesenteric ischemia, or an aortic aneurysm, which is why I'd suggest you don't just Google it. Hello Doctor it. Ask for a real doctor's opinion, yours or ours, as long as it's a doctor, much like Sete.
Pregnancy can be a very exciting time, but also a very stressful one, especially if it's your first. 35-year-old Gabby called us this week asking about which aches and pains would be considered normal and which were the ones to be worried about. She was about 6 weeks pregnant and said she was experiencing pain on the one side of her tummy that seemed to be getting worse.
Before falling pregnant, a lot of women believe that pregnancy is all good hair, glowing skin, and a perfectly round belly. But the reality is that there is a lot about pregnancy that can be just plain uncomfortable. Some aches and pains do happen, but because of the complexities of developing and carrying a tiny person for 9 months, ongoing pain, like she was describing, is not normal. Did Gabby have any other symptoms?
She was also complaining about a little bit of spotting that she assumed was the implantation bleeding that she'd read about. Other than that, nothing else besides the usual morning sickness.
There are various causes of pain in pregnancy, some of which include appendicitis, an ovarian cyst, an ectopic pregnancy, and hopefully not, but even an early miscarriage. All of these are considered emergencies, so she would have needed to see her doctor as soon as possible. Our doctors are brilliant in offering advice and guidelines, but there's only so much we can do from the other side of a telephone. And when it comes to an emergency situation, your best bet is a face-to-face meeting with someone in a white coat.
I asked her to call her doctor then and there while we were waiting for her hubby to come home to take her to the hospital. We chatted through her history to try and understand what the problem could be. She was obviously a bit distressed, so I thought it was important that she wasn't alone, so it was to speak.
That's good advice. She was 35, I think you said, so that puts her outside the age group that's most often affected by appendicitis. Although those sneaky things can flare up at any time, especially during pregnancy, so you couldn't rule it out completely.
She hadn't lost her appetite, which is also a common symptom of appendicitis. But the fact that she was spotting, though, seemed to suggest more of a gynecological problem to me.
Implantation bleeding literally results in a tiny spot as the embryo implants into the uterus, and usually happens around 10 days after conception, at the same time as a missed period. Bleeding beyond this point would suggest something more serious.
Besides pain, ovarian cysts wouldn't necessarily cause any other symptoms, and they are unlikely to cause bleeding.
So we could potentially exclude appendicitis and ovarian cysts, but you could very sadly have an ectopic pregnancy.
Or equally as sad, a miscarriage.
An ectopic pregnancy is one that develops outside the uterus, usually in the fallopian tubes. And it's dangerous because as the pregnancy grows, it increases the risk of the tube bursting. That could result in significant internal bleeding, and life-saving surgery may be needed. Ectopic pregnancies usually occur between 5 and 10 weeks of pregnancy.
So she was at that stage of a pregnancy where the symptoms might start to show up, and her age also upped her risk of an ectopic pregnancy. Some of the other common risk factors include a previous ectopic pregnancy and other conditions like endometriosis.
True, but remember that a third of women with an ectopic pregnancy don't have any risk factors at all.
Because her pain was localized, in my opinion, she had an ectopic pregnancy. But it was critical that she was seen by her doctor, who could investigate further and give her the treatment and care that she needed.
If it was an ectopic pregnancy, it's possible that one of her fallopian tubes may need to be removed. That can be a depressing thought, but it really shouldn't be. You still have a fully functioning tube on the other side and around a 70% chance of having a future normal pregnancy.
But as we said, having had an ectopic pregnancy does place you at risk for another one. So always talk to your doctor about your medical history in as much detail as possible.
And it's always important to listen to your gut and seek help, whether you're pregnant with your first child or your third. You're not being paranoid by checking in with a doctor. Trust me, there is more than enough time for that when your kids are all grown up and learning how to drive. Need advice? Download the free Hello Doctor app on any mobile phone and connect with our doctors right away for reliable personal advice. Go to hellodoctor.com and chat to a doctor anytime, anywhere for less than the cost of an apple a day.